Hello and welcome. Thank you for joining me here. And I'm really pleased to give a talk on a topic that really comes from my heart, and that is glaucoma treatment with laser and performing this non-invasive treatment that's called trabeculotomy. Regarding my financial disclosures, I'm just an advisor to ViaLase. That's the company that produces a laser to treat glaucoma and nothing else. So you know that the trabeculotomy has a long history. What is the nice thing is that it's firmly established in the treatment, because there are different ways to approach, like Kahoot blades or the harms device, so many other things, but all of them are pretty much invasive. Just to give you an idea, the trabeculotomy is the indication for pigment dispersion glaucoma, glaucoma and high myopia, and here you see, for example, congenital glaucoma, of course, which is rare. But there are problems that come along with the trabeculotomy, and that is, for example, intraoperative complications, which are rare, but postoperatively, what you are expecting and what is integral part of a trabeculotomy is the bleeding. Yeah. So if you open the eye, the IOP drops down, and that leads to a bleeding because the pressure, the venous pressure, is higher. That means it's a sign of success usually if you open the eye and do a trabeculotomy. And this comes really as a drawback, because if you're doing this with patients who have a good vision on their eye, and then you have a hyphema or even a full bleeding, you run into troubles. The good thing is with the trabeculotomy, that is extremely efficient, extremely effective, and extremely long-lasting effect. Yeah, and from all of my procedures I've done in my career, that's more than 30 years now, trabeculotomy was the most efficient and the most long-lasting treatment I have ever done in glaucoma. And we published that. It maintains the IOP low, it keeps the visual field intact. It's more than 6 years what we published in a peer-reviewed journal, looking at the different procedures and evaluated all the procedures. So trabeculotomy is an extremely well-perceived procedure. And here comes the point. The good thing here is that we are treating a laser that is not opening the eye. There's no need to open the eye. We are just have the precision of a high resolution OCT, and we all have the benefits of the femtosecond laser, which means also we can micron, with the precision of micrometer, detect and treat the tissue, the target tissue we want to open. Because we are dealing here with the so-called Schlemm's canal, as you know, and the procedure is called femtosecond laser image guided high precision trabeculotomy, or to make it shorter and easier to digest, FLIGHT. So, and I have the pleasure to know all the important people behind this very great company with extremely great minds and engineers that were in the past so successful already with so many other femtosecond lasers, so that they really know what they're doing and they really know how this technology has to be used. And this is, first of all, Tibor Juhas. Tibor is fortunately sitting around, to be honest, and listening to my boring talk. Yes, he would be even better a speaker, but I have also clinical experience, and that's the reason why the company asked me to talk about it. And then, of course, Hadi Strass, then Rick Lewis, who's also around here. Rick is the CMO And I think he doesn't need any introduction. He is extremely successful, great advisor, great colleague and surgeon as well as researcher. And then we have Sean O'Neill. I had the pleasure to spend the IIIC retreat in New York with him. So there is a friendship relation with this company, I have to admit. And here you see the extremely successful track with this company. And really astonishing and really interesting is the fact that in 1995, the company received the grant for femtosecond laser use at the University in Michigan to treat glaucoma first. It's unbelievable, because this is 30 years ago already. Think about what happens just in the short term if you look at iPhone or something like that. And then they introduced the femtosecond laser with this OCT that's called then LensX and was sold to Alcon, as we know. And the IntraLase, of course, the femtosecond laser as a flap maker, but also for keratoplasty procedures and so many other indications. So extremely successful track of this company. And in 2017, so from now 7 years ago, the company came up with this device, the treatment modality, as I described, the flight as a treatment modality for glaucoma. And this is the device. I had the pleasure to see this device live at the University Eye Hospital in Budapest and joined the famous professor who is here. It's Zoltán Nagy. And Zoltán Nagy does not need an introduction. He was the first worldwide to use a femtosecond laser in cataract surgery, and he's also the first, among other things of course, to treat human eyes within a clinical control trial with this flight procedure. And I had, as I said, the pleasure to go over to Budapest, visit him and seeing his treatments, many treatments at that day. And he was so kind, hospitality, and it was flawless, I can tell you. Really flawless treatment, one after the other. I will address that later on, and I'm so glad and happy that you're here. Welcome, Zoltán.
So I think it's an exciting morning, and we did the first treatment 3 years ago, so we have the 36 months result already,
3 years.
which will be reported today during the poster session. And so it's a very effective and very good treatment. So we can prove that after 36 months, the opening which we created with the femtosecond laser, it's still open and patent, and the pressure is going down. So I hope that this treatment will last and will help to millions of people. And I hope also that we can work together and also publish some very exciting new articles. Thank you very much for inviting me and recognizing.
Thank you, Zoltán, for joining us. So let's dig into the technology now. And that is, for example, we have this femtosecond laser, we have an OCT, high resolution, we have a video camera, a docking delivery arm and head, and of course a control system. That's the basic. And then we have a handheld gonio camera that allows you to find the best angle to treat. And then we have a personal interface, and the company took everything in place and into account, which was already known beforehand, but is way superior. And that is, for example, a disposable curved personal interface, because as many of us learned, a planar one is not so good. And then they have a secured cloud-based tablet for remote diagnostics as well as technical performance of the laser and so forth. So the chassis houses the laser system with a touch screen and a user interface. And here you see the stunning high resolution angle view, and that is the normal one. It's a really impressive how nicely you can see all the important anatomical structures and how nicely you now can make a selection in order to treat. And here you see on the upside, on the upper page, you see the predictability that to identify the anatomical landmarks. And here comes the big difference. It's not about the visualization through the photo or video you are seeing, but also you exactly at the same time, the system is aligned to see the high resolution OCT. That means you see the structures, but often it comes with a slight angle, so you can see exactly where the Schlemm's canal is. And that means here in the red dot that you can see there, and the treatment area that comes within a blue rectangular area, you can exactly see that what you are hitting. That means sometimes, you know, because of pigmentation, etc., you're not so sure if you are really exactly in the plane you want to treat. And the OCT, additionally to the high resolution picture you get and anatomical structure information, comes along and is aligned with the high precision femtosecond laser treatment then. That means all these three things come together, okay? And this is a crucial and very important thing. And the good thing is you then create a channel within this area that comes along very precise and can be, within the trial of course, is fixed, but can be changed in terms of diameter, but also in terms of the numbers you intend to perform. So let's go and start the video. My visit here into Budapest, here you see Tibor Juhász, you see Gus Gazar and so many others from Barcelona. So what I can tell you is, when I saw the patient, so the patient comes into the room, there's no drop applied or something like that for medical mydriasis or something like that. The only drop that is applied, of course, is an anti-anesthetic eye drop. If the patient is positioned, the patient is docked, and then some gel is inserted into the personal interface, and then the cone is directed into this personal interface, and the docking is then confirmed because of the pressure and that everything is stable and under vacuum. So the patient is docked and the cone is in this personal interface, and then the first step is to detect the angle you want to see. So you have 360-degree access to the angle, what you see, and then you decide where to treat. And it's clockwise, so to say, alignment, what you want to choose. You make your choice. You can, of course, change this afterwards, and then you start the treatment. The treatment is only within a few seconds. So before you treat, you then check also according to your anatomical view with the video, as well as the view with the picture, as well as the high resolution OCT you have. You confirm this, and then the treatment is done within a few seconds only and doesn't hurt. So the patient has no pain or something like that. It's just maybe a very slight decrease in comfort because of the suction that is applied to the eye. But that's something that's really low, and so the patient has no pain or something like that. I would not expect a bleeding like you have, for example, in trabeculotomy, which is really a sign of that you hit and really achieved what you wanted, that is opening the Schlemm's canal. Here you have a closed system, so the pressure remains stable. There is no drop down of the pressure to zero or something like that. And that means bleeding is a really rare condition here, if at all, especially here. And here you see the pictures, what I told you. Here you see exactly the red dot shows you the treatment area, and on the right side you see the OCT. On the right side you also see the treatment afterwards. So here you see, based on the publication that has been done by Zoltan Nagy and his group together with Aki Ahmed, and here you see the treatment one day on the left, 18 months in the middle, and 24 months on the right side. Yeah, and you see how nicely it remains open. There's no scar formation directly, or no closing of this channel, which is important, with a follow-up of nearly 2 years. And I think Zoltan will confirm this even for a longer period of time. So he just said to me they have 3 years. So then this is the publication. Everybody can read it. It's published in the prestigious Blue Journal, the American Journal of Ophthalmology. And here you see the results, which are impressive, because You can see that we started at more than 22 millimeter of mercury, a baseline, and then you see a drop of nearly 8 millimeter of mercury to a pressure of 14 and 40.5. So there were no serious adverse events with this very standardized treatment. It was 500 multiplied with 200 microns. So in each treatment was the same treatment, one single treatment. So imagine what about the potential of this technology. And in percentage, it means roughly a 35% reduction of the IOP. And and you see no major complication or something like that. An outpatient procedure that there's no need to hospitalize the patient or something like that. And the patient feels well, and they are not under sedation or something like that. I saw so many patients in Budapest. They all felt well after the procedure. It was a quick one. They all confirmed to me that they didn't have pain or they didn't feel discomfort or something like that. So allow me to summarize. Flight, the procedure that's using the ViaLase femtosecond laser platform. And again, I have no financial interest with this device. It's a non-invasive treatment. This is the very first worldwide treatment modality perform a trabeculotomy without opening the eye. Okay? The very first step in a brand new world. And it comes, as I said, with the precision of a femtosecond laser and a high-resolution OCT. The half-year results were excellent in terms of safety and impressive in terms of IOP reduction. And finally, and that's a good thing, the company achieved the CE mark. So we are happy now in Europe to have commercially available the systems, hopefully soon. The company told me it might be end of this year. We all cross our fingers because we have a hard time here, and the company, of course, has a hard time to make it happen. And finally, they made it, and this is a great step for the company, and it's a good sign for their treatment that all went so well. And of course, ViaLase is also seeking FDA 510(k) approval. And I think this treatment modality, I'm convinced, will rock the ophthalmological scene. I see it also not only as a trabeculotomy where you usually would position the trabeculotomy in terms of comparing with MIGS or with the really hard stuff like trabeculectomy or deep slayectomy, but I see this also before any topical anti-glaucomatous drugs, and that impresses me much. Thank you for listening to me. I hope you learned something new, and have a great day. Thank you.